let me ask you this. In your experience, working in treatment, relapse. This is kind of a big one.
Yeah.
Right? Almost every program that I've experienced has some sort of policy against relapse.
Right.
A lot of programs will discharge patients for relapse. And in the rule book says, will not relapse. And if you do, you're subject to leave.
Right.
You know, and then there's this kind of heavy emphasis on relapse is bad. If you relapse, that means you're not serious about recovery or you're not finding success in this program.
You're not committed.
Oh, you're not
You're not working hard
You're
enough.
not committed. You're not doing enough.
Yeah.
You know, and, you know, personally, I feel like it's kind of wild. It's kind of a wild thing as a program to say, we know what's best, we know what's right, we know what's wrong. If you relapse, that's wrong. You're out.
Yeah. I mean, there's a lot to unpack in the relapse conversation. It starts for me at a place of there's nowhere else in healthcare where what we say is the reason you're coming to us for help is this. However, if this happens while you're in our care, we can no longer help you. It's wild, right? It's like a doctor going to see a doctor for your diabetes. And you go in and say, you know what? I didn't take care of my diabetes this week. I ended up in the hospital. And the doctor's saying, well, I can't help you anymore because apparently you're not working hard enough. You don't want it bad enough. You know, you're just resistant. You're not listening. You don't care about your family, whatever it is, right? They would sit with you and say, okay, what worked? What didn't work?
Right.
How do we help? How do we, help adjust some things? Right? Like we take this comprehensive look, everyone in healthcare except for in substance use or mental health care, which is I come to you with the problem, but if the problem happens while I'm with you, you tell me to leave. Total craziness.
Yeah.
Now, on the other side of that coin, you do have to have a little bit of policy that probably says something like you can't continually use drugs while you're in our care, things like that. However, those are ongoing conversations for someone. Yeah. Someone's recurrence of use or relapse, all it's doing is telling us something, right? I think what happens is most people get scared, they get offended, and I'm talking about the professionals. How could you? You were working so hard. How could you have ruined your sobriety time? How could you have done this to your family? How could you have done this to your kids? It's pretty crazy when we think about it. So it's like we can take a step back. Look, if you're telling us that this is something you want to work on and it continues to happen, that's just more information for us to say, what do we need to do? Now, if it continues to happen and you say you do want to keep working on it, maybe you need different care, maybe you need a higher level of care, maybe you need more support, more structure, whatever it is. But that knee-jerk reaction to tell somebody to leave when they've simply done the thing that they're asking us to help them with, it doesn't take a rocket scientist to understand that that's a crazy concept that for some reason only exists in behavioral health. I don't think there's any cancer patient that has ever been told that the doctor won't continue to help them because they don't want the chemo anymore.
Right.
They say, well, let's try something else, right? So.
Hello, Ava Health.